It is my pleasure to welcome you to the actual operating room at Mayo Clinic in Florida. If you have never experienced surgery before, this could seem like a very frightening environment. I hope that by showing you what the operating room actually looks like, and by introducing you to the people who will be part of your surgical team, your very understandable anxiety will be decreased. First, there is the journey from pre-op holding to the actual OR. Your operating room nurse will first meet you in the pre-op holding area. Your operating room nurse will ask you to state your name and date of birth, what surgery you're having, and the name of your surgeon. We know that you're asked these questions several times, but it is critically important that we adhere to safety checks and perform double and triple safety checks along the way. So please be patient with us. From the pre-op holding area, we will wheel you on a gurney into the operating room. The journey is short, and you may not remember it, so we will provide you with a virtual experience now. Along the way, I will point out our commitment to safety orthopedic OR team learning board, which Dr. O'Connor will discuss further in another video. When you first arrive to your surgical room, there will be a flurry of activity. 2 or 3 people will be attending to you and preparing you for surgery. Actually, there may be as many as 7 people in your surgical room attending to all your needs. You might see the surgical technician set up the sterile components needed for your surgical procedure. Simultaneously, your anesthesia team and operating room nurse will be safely positioning you for the delivery of your anesthesia. Please be assured that even though we are all performing multiple functions, you always remain our primary focus. We'll keep you safe and maintain your dignity and privacy at all times throughout your surgical procedure. Always remember that you are the most important person in the room. Immediately after your anesthesia is delivered, your surgical team will carefully transfer and position you on the surgical bed. Your nurse will ensure that your body is well padded to protect you against any undue pressure on your skin, bones, and nerves. You'll be kept warm and safe at all times. We'll perform what we call a prep of your hip or knee by gently scrubbing the skin and cleaning it with an antiseptic solution, all to decrease the risk of infection. After the prep, we will apply sterile drapes, leaving uncovered only the surgical area. Draping prevents infections and helps keep you warm. We call these the prep and drape parts of the procedure. All in all, it takes about 30 minutes from when you enter the operating room till your surgeon is ready to start the procedure. When your surgeon starts the operation, your nurse will telephone the family waiting room desk to update our volunteers so that your family will know surgery is started. We know that your family may be concerned about you, which is natural. We want to keep them informed. When surgery is finished, the incision is covered in a sterile dressing. We will call your family again to update them that surgery is over and that the surgeon will be out to speak with them. You'll be carefully transferred back to your stretcher and taken to the recovery room. We are honored that you have chosen to entrust yourself or loved ones in our care. We take pride in delivering world-class surgical care. Always remember that your safety remains our greatest concern.